Hey everybody, I'm using a nice little watermelon here because I wanted to talk about perineal massage. I get a lot of questions and people asking me what is perineal massage and kind of what is the importance of it. So I decided to carve a watermelon into the vaginal opening. So you can see here, just for a reference point, this will be the perineum. This is what we're stretching during perineal massage. It's right here. It's the tissue that separates the vaginal opening right here to the anus. A lot of times during childbirth, this tissue will tear. So the goal of perineal massage is to actually stretch these tissues and prepare them better. So when you are going through labor, you are less likely to tear. And also if you've had previous tearing, to help remove some of the scar tissue there. So I have a little watermelon. I hope everyone's excited to learn how to do this. So just for a reference, this is the entire opening. So for instance, it's here to here. So when I talk about massaging from 3 o'clock to 9 o'clock, this is gonna be 3 o'clock, this is gonna be 9 o'clock. This is the base of the perineum down here at 6 o'clock, and at 12 o'clock is the top of the vaginal opening here. Okay, so you can imagine if this was a real vagina, your clitoris would be here and the base would be here, okay? First thing you're gonna wanna do, make sure your hands are clean. If you have gloves, you can put on medical gloves. I recommend latex free, or just making sure your hands are clean because you're gonna be using your thumbs, right? Another great thing, if you're really nervous about this or you have really sensitive tissues down there, taking a bath or a warm shower can kind of help warm up that area and improve circulation before you even do this. So once you have your hands clean, you're gonna wanna have something for lubrication. I recommend like coconut oil, something natural. You can also use like a lubricant that's a water-based, like a medical grade one. But what you're gonna do is you're gonna lubricate your thumbs here, right? Just a little bit. You're gonna gently come into the opening of your vagina, right? So this is the perineum, just to verify right here. You're coming into the opening just a little bit. And the depth of it is gonna be to your first knuckle here, right? So when you come in, the first thing you're gonna do is you're gonna load the tissues downward and just very gently, so you're stretching that perineum downward. You wanna only go to where it's comfortable. You may feel a little bit of pinching, like stinging, a little bit of burning, but nothing that's sharp stabbing pain. If it's too much, you need to back off. You don't need to just jam it down, okay? You're gonna just gently work on stretching it downward, going gently, kind of putting on pressure for a few seconds, 5 seconds, maybe coming off it. If you can tolerate more, maybe you hold that pressure downward for 15, 20 seconds and just work on that diaphragmatic breathing. So you're breathing in, you'll feel it stretch downward a little more, and then when you exhale, you'll feel it kind of rise up. Once you've stretched it downward a little bit for 2 minutes, then you can kind of work on going up toward this 3 o'clock and 9 o'clock. So you're gently loading the tissues downward, just like we talked about earlier, but now you're gonna be moving and sliding into the vaginal opening. And like I said, you're only going to the first knuckle. You're just gently sliding back and forth. Same thing as before. You may feel a little bit of stinging, a little burning, but it shouldn't be sharp or super painful. This should be something that's more comfortable feeling. Obviously, it's going to depend on your own body, and everybody's going to be a little different. But same thing, you can work on this 2 to 4 minutes. And then also you can kind of move along the tissues. And let's say as you're moving up to 3 and 9 o'clock, you notice right around here, you're stiff on the right side. You can gently load it there and hold it. So now you're going along your clock at different, let's say 30-minute segments, and you're kind of gently pressing downward and holding it. And same thing as before, when you're loading the tissues and pressing downward, you're gonna wanna hold it for about anywhere between 15, 30 seconds, and you can gently let off and maybe move down further and you load it. Obviously, the closer you get toward the perineum right here and load the tissues, that area is really innervated with nerves. It's gonna be a lot more sensitive than if you're just kind of pressing on your, along the canal up in here. So, and everyone is gonna be a little bit different. And your massage in total should be about anywhere from 3 to 5 minutes, and you can work up to 8 minutes, 6 to 8 minutes. I recommend doing this every day, starting in the 34-week mark. if you can tolerate it. And if you can't, maybe at least every other day, or if not, maybe trying to go for 2-3 times a week. It's really going to depend person to person. Also, I recommend getting a partner. Super recommended, because you have, right, a big belly. You're already maybe a little uncomfortable. You're having difficulty breathing from the babies kind of pressing on the inferior vena cava. So having a partner will allow you to kind of recline back a little bit and rest, and they can do all the work, and you can just kind of close your eyes and really focus on diaphragmatic breathing and feeling that pelvic floor stretch. So I'm going to show you what it looks like to have a partner help you. So we're going to grab my partner, and like I said before, your partner should also wash their hands or wear gloves. So we'll show you what that looks like.